What is the difference between whitening and bleaching?
Whitening is usually by the mechanical removal of extrinsic stains. That's called tooth whitening. What's a tooth whitening? Is like it can be done with prophylaxis in our office, or it can be done with airflow in our office. That's called teeth whitening. Or some patients can use it at home, okay, using some whitening toothpaste. Those remove extrinsic stains from the teeth. Now, as far as going to bleaching, it all depends on the concentration of the hydrogen peroxide or the carbamide peroxide. The main element in any teeth bleaching is hydrogen peroxide. The only variable on the whole bleaching cycle has to do with time. So as far as your question goes, let's say concentrations of bleach of carbamide peroxide between 10% to 16%. We recommend maximum wearing the trays for 2 hours, max to 4 hours twice a day. If you go to 22%, I recommend max placing the 22% carbamide peroxide for about 30 minutes. When you go to the concentration of about 32% carbamide peroxide, I would recommend max around 15 minutes. So the variable is the time. The higher the concentration, the less time a patient should apply the gel on the teeth. Now, one more important point: hydrogen peroxide versus carbamide peroxide. Carbamide peroxide is actually 1/3 of hydrogen peroxide, meaning a 10% hydrogen peroxide is equivalent to 30% carbamide peroxide. Now, again, hydrogen peroxide bleaching gives you a whiter boost right away. But after 2 weeks, it will be the same as carbamide peroxide. So there's a lot of variables in, and as far as the bleaching goes, what technique we're going to use, why we use hydrogen peroxide, why do we use carbamide peroxide, and do we use it with a light or we don't use it for a light.